Good afternoon and happy Friday, Advanced team members. I want to say how appreciative I am for all of your hard work and patience as we've been transitioning from Brightree into WellSky. There's only a few more weeks left and all of our patients will be in WellSky, so I know that will be a big relief for all of you. Again, just thank you for all of the work that you've been doing. I know it has not been easy learning a new system, but I am confident that WellSky will help you and the organization be successful and prepared for the future. So thanks again. Speaking of the future, in preparation for patient-driven grouping models, which will be starting in January and will affect home health across the country on episodic care, we are going to be bringing in Simione Healthcare Consultants next week to meet with some administrative staff and leaders within the organization to really get a good understanding of how a patient gets referred to the organization, how intake works, how auth works, how billing works, how orders works, and how collections work. So for those of you who are going to be meeting with Mark and Claudia next week, I encourage you to be open and honest and transparent about what you're doing so they can get a really good understanding and provide resources to us to better prepare for the changes that are going to be coming. And just for your information, I want to let you know that Mark is a seasoned home health and hospice finance leader, and Claudia is a nurse leader and former home health administrator with over 3 decades of nursing experience. So we're definitely going to be bringing in the experts to help get us ready. Also next week, we will be having Fazzi in our office. Fazzi is the name of our new billing company that is going to be taking over billing for our home health operations. So, in the office next week is also going to be David, whom many of you have already met, our new CFO, and Melanie, our new revenue cycle director. So please keep an eye out for them and be sure to introduce yourself. Also, Gerson will be in our office, our board chair. He'll be in next week, so feel free to grab him and bend his ear while he's here. I want to let you know that we've had some great interviews with some patient care liaisons in the last couple of weeks, and we'll be inviting a number back early next week for second and third interviews. So be on the lookout for some new faces as well. I want to give you a quick update on my trip to San Diego last week. In addition to having the opportunity to meet with a number of hospital and healthcare leaders in the San Diego area, I also had the opportunity to work with our San Diego staff, who made me feel very welcome. I also met with Tom, the founder and inventor of a wound app that we have been piloting in our San Diego location. And in that time, we've seen significant efficiencies for clinicians and more accurate measurements. We've also seen and have heard from the clinicians using the app ease when measuring and recommending supplies and wound care products. So I was glad to meet with Tom, and we are looking to roll that project out across our network next year. I also got to meet and interview our new patient care liaison that will be accompanying Rich down in the San Diego market. His name is David, and he is an LVN with years of cardiopulmonary experience. So we're excited to be having David on board with us. I also got to meet Jude when he was in the office this week doing his Relias and orientation paperwork. So if you see some new faces around the office, please extend a hand and introduce yourself, get to know them, and explain how long you've been in the organization and what you love about it here. That really helps build a good sense of family that I think that we all share. I do want to let you know that we have also hired the clinical director for the North Bay office. Her name is May, and she is coming to us with significant home health experience. She's going to be starting in the organization at the end of October, so she gets out of the moving responsibilities as our branch in Benicia moves to the Pleasant Hill area. But we are excited to have May on board. She is very excited to help us grow and really expand our roots and mission in East Bay Market. So we are also going to be having Kristy start next week. She's one of our new patient care liaisons for the Sacramento area. So with that, I will let you go and hope you have a wonderful weekend. Please keep up the good work.